we have found that Sculptra can actually increase your skin thickness by 1 to 2 millimeters. And if you want to age naturally and gracefully without anything, then that's okay too. What happens as we age is we actually lose our deep fat and our superficial fat starts to descend and drop. We're not going to get longevity from filler until we build your lips. Hi, everyone. Welcome to the Perfect Dose podcast. I'm your host, Kristen Herzog, board certified nurse practitioner and injection specialist. So I cannot believe, you guys, it is almost Thanksgiving. Holidays are quickly approaching. It is like busy times. I don't know about you, but I feel like 2024 freaking flew by. Like suddenly I blinked and it's November and we're already planning for 2025. At Perfect Dose today, we literally just went through all of our 2025 promos, events that we're planning. We're going to be doing some really fun lunch and learns and just some really exciting things. We're launching and expanding more parts of our functional medicine and wellness side. So super, super exciting things, but I just cannot believe that it is almost 2025. So I thought this episode would be very exciting and very fitting for this time of year because I feel like in 2024, we saw this turn of events in the aesthetic world, for lack of better words. We suddenly went from, oh my gosh, everybody wants to do filler after COVID 2020. People were like, give me filler. In fact, Galderma launched Restylane Kiss, which is one of my favorite products, literally in COVID times. Like 2020, we launched a new filler. That's insane. So fillers were just dominating 2020, 2021. And then suddenly it seemed like 2024, people had this shift and decided, well, let's look more natural. Natural is in. And I really loved this shift because I have always been a fan of natural results. I am not here for like big, huge freaking lips. The first thing that you see when you walk in a room, like, no, lips should look very natural. They should match your face. I love facial balancing. So I was really excited for this push towards more natural and less fake because fillers and aesthetics can be natural and so many people don't understand that. And in fact, I think fillers got a very bad rep because so many injectors are just injecting patients because patients come in and ask them for it instead of educating them, being the medical providers and deciding if this treatment that they want is even the right fit for them and making sure that they are trained in order to inject these areas. Arizona doesn't have a lot of regulation for injectors, so it's like the Wild West out there sometimes. I did an episode on making sure that you see a licensed provider because this is all super important and it matters, and how you get injected and the outcome, the results, all of these things are determined based on your provider. So choosing the right one is super, super important. But we saw this shift in natural and I loved it. But something else that came about was people suddenly got scared of fillers. And I've seen a lot of things on social media, a lot of fear mongering. We've all seen the MRI that showed the filler face, which actually, we did a deep dive on this, and I don't know if I posted this on social media, but that MRI photo, although it looked scary, that patient actually looked very natural, and the injector that treated her showed her true before and afters, and like you would have looked at her and never known that she was injected with filler. So lots of fear mongering surrounding that MRI. Also, people are talking about Botox being toxic and all of these things. I did a recent episode on this. So if you haven't listened to the navigating toxins in your non-toxic era, you need to listen. But for today's episode, I want to talk about fillers versus biostimulators because I want you guys to understand there are treatment options. And if you don't want to get filler, you don't have to get filler. And if you're interested in a more natural approach, you can choose biostimulators. And one of my favorite things to do is actually to combine them both. If you have seen me in practice, you follow me on Instagram, you know I am holistic. Natural is in. I love biohacking. I love regenerative medicine. So using tools that are going to actually create change in the body, that are actually going to make you young, are some of my favorite things to do in practice. And it's something that I do all of the time. I combine fillers and biostimulators. I put my patients on 1-year treatment plans. I love the natural trend. So I want to talk to you guys on today's episode. I want to break down fillers versus biostimulators, the biggest differences, how to know which one you should get, ways to combine these in practice, and just a little education so you guys truly understand your treatment options and the exact outcome that you will be looking for with both of these options. I want to start out by saying all aesthetics are optional. It is an elective procedure. So if you are watching, listening, maybe you're like, oh my gosh, don't get filler, don't get anything in your face, it's not natural. That's fine. You can have your opinions. Everybody has a right to do whatever they want to do with their face. So if you want to age naturally and gracefully with the help of fillers and biostimulators and Botox and all the things, amazing. I am right there with you. And if you want to age naturally and gracefully without anything, then that's okay too. It's okay. And these are elective procedures. So I want to make sure that we start out with that. Nobody has to get these things. It is completely optional. However, if you are deciding that you are wanting to get these treatments and you just want to know a little bit more about it, this episode is going to educate you on that. So fillers. What are dermal fillers? Fillers are a gel, and there are lots of different types of gels on the market. There is different brands. A lot of people are familiar with Juvederm, with Galderma. There's Revance. There's the company that makes Versa. There's Evolus. There's so many different aesthetic companies. The ones that I use at Perfect Dose in my practice are Revance. I use Juvederm and I use Galderma. Those are the product lines and MERS that I carry. So I am going to be able to speak on these products. They're all from the same lab-made hyaluronic acid, and lidocaine is added, which is the numbing agent. And then they are formed by different ways of cross-linking. So more cross-linking that they have, the longer that they last. Some gels are formed to have more structure. Some gels are formed to have less structure. Some gels are formed to be more stretchy, less stretchy. So different gels are comprised slightly differently, but they are all hyaluronic acid-based gels. And that is super important because hyaluronic acid is naturally found in our body. And hyaluronic acid's job in our body is to hydrate. The more hyaluronic acid we have, the more hydrated our skin looks and feels. Hyaluronic acid is like our built-in natural moisturizer. So fillers are going to be made of hyaluronic acid, which means their job is going to be plumping, hydration. That is what fillers do. So fillers are plumping. So when you are thinking, okay, where can I get fillers? I like to think of it as, where do I need volume? Because what happens as we age is we actually lose volume over time. And this is a very funny concept for patients to understand, because you're like, I don't want my face to look fat with filler. I do not want more volume to my face because volume feels wide, volume feels big, but that's not actually true. What happens as we age is we actually lose our deep fat and our superficial fat starts to descend and drop. So because we have volume loss in areas like our mid cheek, we have volume loss in our temples, we have volume loss around our mouth, we start to appear more hollow, more aged, more tired. And this is because we lose those fat pads. Deep fat starts to deflate. Superficial fat starts to descend. Our bone starts to change. So our bone actually starts to thin. The bone in our jawline actually starts to move backwards. Our muscles start to thin. So we may feel like our lips look less voluminous over time. So we are losing volume, and the job of fillers is to replace volume that's been lost in a natural way. And I always tell my patients, I will never put something that wasn't there before, meaning I am simply going to put back volume, restore volume that was lost with time. And yes, we can do things to change our face, but the goal is not to change our face. We need to be enhancing our faces. So maybe you come in and naturally, let's say you're like in your 30s and you have lost volume in your chin. You're like, you know what? My chin used to look more projected. It used to have more volume. We can add filler there to mimic what you once had. But maybe you're coming in and you're like, well, I've never had a chin before. Is it possible to enhance my chin? And the answer is yes. Filler can enhance your face. And the key is just, again, finding that right injector that is going to make sure that you look natural and balanced and that we maintain harmony with all of our facial features. But So that's what filler does. It is a gel that adds volume. So areas that we can treat with filler are going to be the cheeks, we can treat our temples, we can treat our chin, we can treat our jawline, we can treat our lips. Those are the most popular areas that can be treated with dermal fillers. And I like to think of dermal fillers as not only volumizing, but contouring. So areas that we want our cheeks to look a little bit more defined, areas that we want our jawline to look a little bit more sharp and like that hockey stick shape versus that W shape as females and even males. This is what filler can do. Filler can enhance your face, filler can contour your face, filler can add volume where volume has been lost. Now, because there are different types of fillers on the market, and like I said before, fillers can be very structural, they can be very stretchy. Choosing the right filler is going to be very important. There is something called filler rheology, and I love filler rheology because I'm a nerd and I read all about it all the time. But filler rheology is essentially a product's personality, so how it's going to look and behave in the tissue. And as aesthetic medicine providers, we need to understand this. We need to understand rheology because not all products are created equal, and certain fillers should not be placed in certain areas, and this can lead to unnatural results. So, for example, if we are filling the lips, and lips are not meant to be the first thing that you see when you walk in a room. I like to think of lips as like the cherry on the sundae. They should look very natural, very balanced, but especially with females, we want our lips to look refined. We want them to look hydrated. We want them to look crispy, sharp. It is something that adds beauty to our face. So lips are very important, but when it comes to fillers, people are often scared of getting their lips done because they've seen people walking around with huge freaking filler lips, and that's unnatural and it's not supposed to look like that because certain products should not be used for certain lip tissues. So when it comes to the lips, we have to choose a product based on your tissue strength, based on your structure, based on your normal anatomy. So, for example, let's say you come into the office and you're interested in lips and you're super nervous because you're like, I don't want my lips to look big and weird. Well, they're not going to if you choose the right provider. And what we talk about in my consultation is, okay, let's assess your lip structure. And I will literally feel the lip tissue. And if your lip tissue is looser because of age, volume loss, then we need to choose a filler that is very stretchy, that is going to integrate into all the little nooks and crannies and provide hydration like an internal chapstick. Let's say that you come in and you've lost structure. So the border of your lips isn't as sharp or defined as it once was or as you'd like it to be, then we can choose a filler that has a little bit more structure and we can begin to shape and define your lips. So it is so cool how many cool things that we can do with fillers when we understand how they're made up and where they go. And in areas like the jawline, for example, we want a very structural filler. We want something that's going to mimic bone and add that sharp definition and contour. So all of the filler options out there are so many, and providers have to understand how these products are made up when choosing them for our patients, choosing what areas to treat, choosing our fillers based on our patient goals, based on our patient anatomy, based on their tissue strength, their structure. All of these things come into play when we are deciding what fillers to use and to ensure that you can get natural outcomes. So now that you guys understand what filler is, what about how long does it last? People always ask me, well, if I get filler, how often does it last? And is this going to stretch out my face? Well, I need to keep getting it. And so I'm going to explain all of this to you guys. So filler has a different shelf life pending the gel that we use. And this means if we use a filler that has a lot of structure in it, it's going to last a lot longer than the soft, stretchy fillers. So oftentimes filler in our lips is going to break down faster than the filler in our jawline or the filler in our temples. And other things that contribute to how long filler lasts is where we're placing it, meaning areas of animation. We smile, we laugh, we talk. These are all muscles, and muscles are going to break down filler. So if you are getting your chin done and you're like, well, I got my chin filled 6 months ago and I suddenly need it again, you probably have a strong chin muscle, and this muscle is going to work out that filler. So how long a filler lasts is going to depend on the gel strength and the gel structure. So typically, as a rule of thumb, I will tell my patients that lip filler is going to last around 6 months. You shouldn't have to do your lips more than twice a year. Now, when I say more than twice a year, that means once we are at your goal. So in my practice, I call this lip building. And oftentimes patients will be like, well, this filler was supposed to last me a year, but my lips don't look the way I want them to. Well, we're not going to get longevity from filler until we build your lips, meaning we may need 1, 2, 3 syringes to get to your goal. And then once we're at your goal, you are on maintenance, meaning at that point, then we can do fillers about once or twice a year when it comes to lips. And that type of filler is very soft, very stretchy. So that's why it's not going to last as long. So then there's a product called Juvederm Volux, and Juvederm Volux is one of my favorite products for snatching and contouring the jawline. This filler is very firm. It provides a lot of structure. It's going to mimic bone. So this type of filler is going to last a lot longer. In fact, I tell my patients this filler could probably last you about 2 years. And that's because it is so firm. It is going to be harder for the body to break down over time. It's not going to break it down as fast as a filler that we choose for the lips. And also the area that we are injecting isn't fighting against muscles. And what I mean by that is, like our lips, for example, we have a muscle around our lips and we're pursing our lips. We are using that muscle all of the time. So the muscle is going to fight the filler and break it down faster. On our jawline, we are chewing with our masseter muscle, but oftentimes that filler is placed underneath the muscle. So we are going to hold on to this filler a lot longer than we do fillers like in the lips. So depending on the type of filler that we use, that is going to depend on how long your results last. So for areas like jawline, for areas like cheeks, this typically will require anywhere from 3 to 5 syringes per session, and you may need multiple sessions. So often in my practice, I will tell my patients, let's plan for 5 syringes, then I'm going to see you back in 6 months. We are going to assess your results. If you are like, oh my gosh, I look amazing, I'm so happy, great. You are on maintenance, and a year from the day that we filled you, we will plan to reassess your filler, and I will most likely be adding half of that amount for maintenance every single year. And if, for example, you come in and you're like, well, I feel like I need a little bit more cheek support, a little bit more chin support, it feels like some of that filler volume has been lost over the last 6 months, then we will add a little bit more filler, and that may be 2 syringes, 3 syringes, whatever it is. And then at that point, we will maintain every year with half of the amount of the total volume that we use. So on average, you should plan for 3 syringes every year once you achieve your overall goal. And that's for areas like jawline, chin, mid-face. When it comes to the temples are a very popular area to treat, especially right now because temple indication just came out with Juvederm Voluma. So everybody is talking about temples. We have been treating them for a long time, but they are just now being talked about. So temples are going to be an area that lasts a long time because similar to the jawline, we are filling underneath the muscle, or in the temples, we're filling very superficial above the muscle, but we don't have a tug-of-war game with an area like the mouth, with us having expression, with puckering, with smiling, with all of those things. That filler is typically going to last a lot longer. Usually temples, I tell my patients, plan for 2 syringes and 2 sessions, and then maintenance is every year. So for the most part, we can get away with maintaining fillers every single year, but we have learned that fillers are lasting a lot longer than that. I can give you guys an example. So when I had baby Jax, I have had filler literally every year for like several years. So let's say I've had around 10 syringes in my face. And after baby, I still did not look like I did before I had any filler. So a year later, I still had some of my product there. And every year I maintain, but I'm barely doing filler at this point. Recently, I did do 5 syringes, and this was probably my first time doing that much filler in like 3 years. And that's just because filler does last a long time, and we are having this compounding effect, meaning the more we layer, the longer we are seeing these products last. So it's very cool. It isn't an investment. It is something that you can get. And if you want to maintain it, it can be maintained annually, sometimes even longer, especially if we are doing combination treatments, which I will get into with biostimulators, because we are not just treating with filler. Filler alone is not going to make you look natural, meaning Filler can't fix everything. We can't tighten skin with filler. We can't stimulate collagen with filler. So there has to be a healthy balance between filler, biostimulators, skin tightening treatments, skincare at home, and I am doing all of those things. And that is also going to make my filler last longer, and it's going to make me need less filler over time. So now let's talk about biostimulators and what they are. Biostimulators are treatments that stimulate collagen, and collagen is the protein in our body that makes our skin firm, bouncy, tight, and elastic. We lose collagen every year. We are on a collagen decline. And yes, I do encourage patients to drink collagen powders, to take their supplements. I love colostrum, all of these things that help with collagen. But the type of collagen that it is helping is usually type 2 collagen, which is great for our hair, skin, nails, and joints. But it's not type 1 collagen. And type 1 collagen is the most abundant collagen found in our skin. And this is going to be the one that we see the most changes with in our skin texture. So we see fine lines, wrinkles, we see increased dryness, changes in our skin as we lose this type of collagen. So biostimulators are going to force your body to make type 1 collagen, which is so freaking amazing. So biostimulators, when I say that, I am talking about Sculptra and hyperdilute radius. Now, for the purpose of this podcast, the most popular biostimulator, the one that I use most often in my practice, is Sculptra. So that's the one I'm going to talk about. I love hyperdilute radius. I use it for certain areas, which I will get into, but for the most part, I am using Sculptra in the face. And Sculptra is this biodegradable, biocompatible biostimulator. So biodegradable means your body is going to break it down naturally. So it's PLLA, polyl-lactic acid. And essentially what happens is the polyl-lactic acid gets injected into your skin. And then that polyl-lactic acid is broken down. It leaves your skin, and then you are left to create your own collagen. So the PLLA, the Sculptra, is almost like a fertilizer. And this fertilizer is going to fertilize your collagen, and your collagen is then going to begin to grow and sprout, kind of like a garden if you're a visual person like me. And this is going to improve your skin elasticity. We have found that Sculptra can actually increase your skin thickness by 1 to 2 millimeters, which is freaking amazing. We are injecting Sculptra to tighten skin, to replace volume. So if you're someone that works out a lot, you've lost volume over time. I see this often in my practice with like my runners, my bikers. We need Sculptra because it's like my skinny girl problems. They get volume depleted, and Sculptra is a really great way to mimic natural collagen and to revolumize these patients without them looking unnatural by using filler alone. So biostimulators are collagen stimulators, and they have their place. Now, it's very important to understand the differences. So filler is going to add volume, it's going to contour. Sculptra biostimulators cannot contour. So if you come into my practice and you're like, okay, I want a more sharp jawline, I want a more lengthened and projected chin, Sculptra cannot do that. Only filler, the gel, can do that. Only the gel can add contour, projection, and volume in that way. But areas that we can treat with Sculptra are like cheek wrinkles. We can treat smile lines with Sculptra. We can treat the neck, the chest. We can treat the body with biostimulators, which is really cool. So it will add small amounts of volume over time naturally by tightening your skin and stimulating collagen. So that's what biostimulators do. Now, another key difference when you are deciding which one to get, because a lot of you might be like, well, Sculptra sounds freaking amazing. Why am I even getting filler? And it's important to understand that, again, filler is the one that is going to add contour, shape, and volume in a way where we cannot do with Sculptra. However, I love to use them both in my practice because I think it's really great to be able to add volume in certain areas and then seal the deal with a collagen stimulator. So that is like my secret recipe at Perfect Dose. I am doing full facial balancing with filler and with Sculptra. And I will tell my patients this. I'm like, okay, let's build the house. Let's build the foundation with filler. Let's add that projection to your chin. Let's add that volume back to your cheek that you've lost. And then let's lock it in with Sculptra. And Sculptra is going to stimulate your body's own natural collagen. So you will need less filler over time. You will look more natural. It is absolutely amazing tool in the toolbox. Something though to keep in mind is because we don't lose collagen overnight, we don't gain it overnight. So Sculptra is not instant results. So I tell my patients, Sculptra is like the 401k for your face because it is going to last a very long time. With Sculptra, you're going to have collagen stimulation for 2 years, which is very amazing. And it is stimulating your own natural collagen. So it's like 401k for your face. But it takes a while to see results. So when you're getting Sculptra, you are not going to see instant results, and you're often going to need multiple sessions before seeing those outcomes. So what does that treatment plan look like? When I'm doing Sculptra in my practice, I will do 2 vials per treatment, and I always do 2 vials. 2 vials no matter what. 1 vial, you're really not going to see much. So 2 vials is the standard, and I will treat temples with Sculptra. I will treat cheek wrinkles. I will treat the chin shadows. I will treat the smile lines. I will treat neck. I will treat areas of volume loss or areas where I want to improve skin elasticity with Sculptra. And then I have my patients come back 6 weeks later and we assess. And we typically do 1 more treatment unless you're like doing this for prevention, which we will get into. But I will typically do 1 more treatment. And then after that, we will do Sculptra once a year as part of your annual maintenance. And if we're getting it for prevention, that's a little bit different. So people might be thinking, well, why do I need to get Sculptra every year if it lasts for 2 years? And the reason is that we are losing collagen every single year. So if we want to be preventative with Sculptra and we want to correct, we need to do it every single year to prevent that collagen loss. Does that make sense, you guys? Like, it is all about prevention. So can you get Sculptra and wait 2 years? Yes, of course. But you're still going to age. So although you will look better in 2 years than you did at baseline, you will still see more signs of aging. So you may look in the mirror and be like, well, it doesn't look as good as it did. Well, of course not. We're losing volume. We're losing collagen every single year. So that's why maintenance is super important. And it's similar to fillers. Fillers, like we talked about, have this compounding effect and they last and you need less filler over time. But it is not going to like stretch out your tissue or make you look weird if you decide not to get filler ever again. Again, I'm a perfect example. I had baby Jax, so I had no filler throughout pregnancy, which is 9 months. I didn't have any filler while I was breastfeeding, and I breastfed for 4 months. And after that, I actually didn't get filler. I got Sculptra afterwards and I did skin tightening and lasers and just recently got filler. So I waited like 2 years essentially before getting filler again. And I still looked better than I did before. My face wasn't stretched out. There was nothing weird, nothing at all. I looked very normal. So if you are deciding between Sculptra and filler or to get these injectables at all, it's important to understand that you can try it and you're not locked in. You don't have to do this forever. You can try it once and then maybe you wait a long time and don't do it again. Maybe you have a big event coming up and you want to look really great for it. And then afterwards, you're like, you know what? I am going to get pregnant or it's just not my season to spend a lot of money. So I'm going to hold off on it. And that is totally fine. These are elective procedures and you can get these procedures to feel good. And that's the point of them. The point of getting anything aesthetic is so that we can look in the mirror and have increased confidence. That's why I do what I do. I tell my patients my job is to inspire confidence. I became a nurse because I wanted to make people feel better. I wanted to help them. And I got into aesthetic medicine because I realized that I could do that exact same thing on like a whole different level. And if I can improve how you feel, and I can get you so confident where you're like, okay, I'm ready to go on this date now. I'm ready to buy these new clothes. Then I have done my job. And that's the purpose of aesthetics, is to give us enhancements, to inspire confidence, and to make us just feel good. So do whatever feels good. Now, I want to talk about a treatment plan and how I use these in my practice. So we've talked about fillers, what they are, what they do, areas to be treated, how long it lasts. We've talked about biostimulators, which is Sculptra, hyperdilate radius, how long they last, how often you should get it, areas to be treated. Pro and conning, one is going to give you instant results. One is going to not give you instant results, but more longevity. One is going to be natural, meaning you're not putting anything in your body that's unnatural. The PLLA is biocompatible, biodegradable, and it's going to leave your body, and then you're going to be left to stimulate your own natural collagen. The other one is not natural because it is a hyaluronic acid gel. However, it has been studied and proven to be safe and effective for treatment, and when used appropriately can be very, very natural. So you don't have to worry about looking like a filler face. Another pro of filler is it can be dissolved. So we have dissolver hyaluronidase, which is an enzyme that naturally dissolves filler. So worst case scenario, if you're like, I got filler, I freaking hate my face, you can dissolve it. So it is dissolvable. That's another pro of filler. And my favorite thing to do is to combine these two together. Put my patients on a 1-year treatment plan and give them options for both. So I typically will assess my patients. We will do filler for facial balancing. So areas that we need to project, like the chin, areas that we need to add contour, like the cheeks, like the jawline, we will add filler. Areas that we need to add structure, hydration, like in the lips, we will add filler. And then we will add Sculptra to lock it all in. So Sculptra is my collagen stimulator, and that is going to improve skin elasticity. That is going to help with smile lines. It is going to make you look more youthful in a natural way, as if you are aging in reverse. Now, a lot of you might be listening and you're like, okay, so what is the cost of these things? How much is a typical investment when it comes to fillers and when it comes to Sculptra? And the answer is it's expensive. It is not cheap to get these products. You are not only paying for the product, but you're paying for the expertise and the person behind that syringe, because it takes a lot of training to be able to inject safely, to be able to deliver optimal outcomes. It takes a lot of skill. So keep that in mind when you are choosing your providers and finding clinics to be treated at. But on average, I tell my patients that initial investment when it comes to fillers and Sculptra are going to be anywhere from $2,000 to $6,000. And then maintenance is typically around $3,000 every single year. So that is an average price when we are talking about facial balancing, full correction, and full treatment when it comes to these products. If you're listening and you're like, okay, sign me up, I want filler, I want Sculptra, but I can't afford to get both at the same time. Now, there are options to get one and then the other. So typically, I am seeing my patients in the summertime for Sculptra. Why? Because Sculptra is going to take longer to see results. So by the holidays, they look snatched, ready to go, and they see their outcomes. And in the wintertime, like around right now, the holidays, I'm doing a lot of filler. And that's because people want to look good, they want instant results, and they do not have patience. So on average, I would say most of the time during the holidays, I am doing filler. A lot of the times in the summer season, I will do a lot of Sculptra, but doing both is a game changer. So after hearing this episode, make an appointment, make a consultation to see what you are a candidate for, discuss your goals, and maybe see, okay, am I a candidate for filler in these areas? Am I a candidate for Sculptra? Is this going to give me the overall look that I want? So thank you for tuning into today's episode. I will see you guys next week. For injectors, for my techniques, for how I consult, assess, treat patients, follow me on Patreon. I will link it in the show notes. And for everybody else, if you want to see before and afters, if you want to have more education about these things, then follow me on Instagram at The Perfect Dose.